we do monitoring during the financial year, and then ministry will come out and write a directive and say, please, all local government, don't expect that money. We are retaining it at the center. That is after they have said, yes, we have given you money for primary health care. So they arrest the money.
I want to add on that
they arrest the money and
has ministry retaining money instead of taking it to local government. Yesterday we were on in Parliament on the Health Committee, and we presented some of these issues. And one issue that came out was about primary health care development. And Ministry of Health has retained about 12 billion shillings at the center. And it is claiming that it's going to do procurement of beds for all health facilities in Uganda. But first, Ministry of Health itself, within Ministry of Health, they have issues of procedures and long procurement processes. So we are wondering if the ministry is taking up procurement of all health facilities in Uganda. How would it be? Secondly, information has it that immediately they had allocated that 12 billion to Ministry of Health. We received funding from the Chinese to provide
a donation of 7,000 beds.
Yes, 7,000 beds. And right now, Ministry of Finance has written to Ministry of Health to give clarification on which districts and health centers would be receiving the beds, but also stopping them from using the 12 billion. And Ministry of Health has not given any response to Ministry of Finance.
Okay, maybe they're still thinking it over.
But what we are saying is, can we have money? You see, we have a lot of money redundant in different areas, but because we have people who don't have the love of Ugandans, they want to keep that money for themselves. They want to keep that money for their individual benefits and developments. But we are saying, can we have that money, part of the 12 billion that is not going to be used, allocated to other areas within the health sector?
This may not actually be the only reason why we have a low budget going to the health sector. Let's see some of the other reasons that are causing this trend of having a 0.1% increase, which is almost nothing. Let's talk about other reasons that are causing a low budget for the health sector.
For me, you see, a budget is a document that defines the priority of government. So how they allocate fund tells you where government priority is. So by nature that health sector financing has been very low, it gives you an impression that government has not prioritized the health sector in Uganda. Yes, that is the whole point. It is about prioritization, because who doesn't know that women are dying in Uganda? Who doesn't know that we need health workers in Uganda? Who doesn't know that children are dying before even seeing their mothers or knowing their mothers? I mean, it is terrible. Even where the president comes from, people are still dying.
Now, I want us to talk about now way forward as we plan, as we try to make the health sector the best that it can ever be in this country. What are the priorities that we should start from? Give me 5 things that you say, because there are so many that you have listed in the sectoral problems, but what needs to be done first, what needs to be stemmed, what needs to be cut down, what needs to be repaired?
Oh, okay. Well, for me, my biggest issue is on staffing. Right now, we are running a campaign called Value Our Health. Under that campaign, we are calling upon the government, and we have, unfortunately, we didn't move with some of our commitment cards. We want all Ugandans to put our voices together to have the government to allocate 36 billion in the budget right now, which is under the unfunded priorities, to recruit 3,542 health workers, and these include doctors, nurses, midwives, all the specialists that are needed to bridge up the funding gap. I mean the staffing gap, because you see that very many people will not go to a health center if they know they cannot find a skilled worker. So why will I even waste time? So very many people, it is what can I say? It's a put off for a person. If I'm sick and I know the doctor is not there, there is no nurse, there is no midwife, will I have the motivation to go? So we are calling upon the government to fund and we fill up the staffing gap. We have those doctors, we motivate them, such that even the attrition rates become low. Because like she earlier mentioned, at health center fours, they are young doctors, and they are not about to go from there because they have been given something that, you know, interests them to keep them at those facilities. So for me, the number one thing is that government should provide that money, and then we recruit those workers. Because, you know, in the maternal deaths, you know that 19 women die every day from childbirth. I'm not saying that it is not only because there are no midwives, but it is a big, it contributes a lot to the people who are dying. So if we have the staff recruited, then we can as well look at the primary health care, then we can look at, you know, the different dynamics. But for me, the most important thing right now is to recruit the health workers that we badly need.
Okay.
On top of recruitment of health workers, when we talk about motivation and then retention, motivation comes in different bits. Even the functionality of a health facility is a motivator to the health workers.
Okay.
And parts of the health center functionality in terms of support is primary health care funding. Research has been done, and we have found out that if government allocated 35 billion in local governments for primary health care, it will improve the functionality of health facilities. So my recommendation to government would be, can it find the 35 billion the way they go to parliament and say State House needs 70 billion supplementary? Can we have a 35 billion if it is supplementary to improve primary health care funding for Uganda to cater for the lower health facilities functionality?
Okay.
Yes.
That is what we should prioritize as we try to make this Uganda better. Just in 1 minute,
not to forget, because she talked about recruitment,
yes,
we're talking about primary health care funding, but not forgetting HIV.
Okay.
It is really a very big issue, not forgetting about the HIV.
Okay, recruitment,
primary health care funding, and HIV.
All right, thank you very much for joining us for Morning Flavor. Diana Tibetsigwa
Thank
and Fiona Orikiriza from the Civil Society Budget Advocacy Group. We try to ensure that the Uganda budget making process is more participatory, and also citizens' concerns are being put out there in the budget allocation process and also in the implementation of the national budget. You're watching Morning Flavor. Let's take a short break. We'll be right back.